Hi, this is Dr. Russel McKenna with Yada Yada. What do you do when your child is puking their guts out and pooping their pants? It's awful, isn't it? Let's talk about it. So, when children have vomiting and diarrhea together, most of the time it's one of the summer bugs that they get from the swimming pool or the playground or the grocery store. Things that we look for is like, where have you been? Who else is sick? What else is going on? Is there fever? Is there blood in the diarrhea? Is there green in the vomit? Those things are important to note. If you've had some foreign travel, that one's really interesting because you may not be used to seeing certain diseases in your community, but all you have to do is hop on a plane and you can bring a whole bunch of fun things back with you. So what we want to do when a child is vomiting and having diarrhea is most of the time they will start puking. And there might be some violent puking where it's just like very steady vomiting for a few hours. They may not get horribly dehydrated at this point. And so if that subsides and you start to feed them and then you see random puking, just know that you maybe started to feed them a little too soon. 3 things will make you throw up: fat, protein, and large volumes. So what I like to tell my patients, or the parents of my patients, is don't give them fatty foods. When you're sick, you don't want to eat a hamburger. And so keep it simple. They need sugar, they need electrolytes, and they need water. It's not uncommon to see a patient that comes in and their urine has some ketones in it and they just look punky, but they still have some wet mucous membranes in their mouth and they had a wet diaper or they peed that morning, but they need sugar. The body does not like to function on broken down fat to make sugar. It wants to have sugar. So don't worry about feeding them the fatty stuff or the high protein things. Give them simple things, Pedialyte or Gatorade. So your job as a parent when they're throwing up is to not worsen that with those large volumes. So I like to call it, we nickel and dime them. You give them a milliliter a minute of liquid or 5 mLs every 5 minutes. If they do well for a couple of hours, do 10 mLs for every 10 minutes for a couple of hours and keep advancing that up to like 30 mLs every 30, 60 every 60. And if they can keep that down, then you're able to keep them hydrated. They usually have wet diapers or pee in the toilet, and they usually stay a little more active because they now have sugar that's fueling their brain, and so they feel better. Now, when it moves to diarrhea, this is where you can get into trouble. If you're puking and have diarrhea and you can't get anything in them to stay and they're losing a lot of water from their bum, then they're going to get dehydrated quick. So this is where you probably want to seek help and get a weight check, and then make sure that if your child hasn't had any urine output for a minimum of 12 hours, you really should get some help. And sometimes children need IV fluid. Sometimes they just need an oral challenge in the emergency room, and sometimes they use antiemetics, which is anti-nausea medicine. We don't routinely like to use that because it just masks the underlying problem, and that is, it makes them want to eat, and then all of a sudden they throw up again. So there's a fine line to find with that. But you don't want to feed the diarrhea, and so don't do milk or ice cream. Lactose is just horrible. Same thing with a high fatty meal. Like if you want to see snotty diarrhea, feed them a lot of fat. You're guaranteed to see that. But a bland diet like bananas, rice, applesauce, toast, it's not a lot of calories, but it doesn't usually worsen the diarrhea. The pectin in apples can help thicken it up. Bananas usually thicken up. I've met a few kids that are get diarrhea with bananas, so if your child does that, don't use bananas. But that kind of stuff, along with maybe some probiotics, and then the clear liquids that have sugar and electrolytes in it, are usually very helpful to nurse them along, to get you further away from the day one when things started. And the further away that you get from the illness, the better. Usually, it's a couple of days at the most, but it's not uncommon to see 1 to 2 weeks. If they get a viral infection that causes lymph nodes around the small bowel and the supporting structures, that's called mesenteric lymphadenitis, and we'll have a video on that because that's an interesting one. But if they get that, you're really going to be not able to feed them regular because their stomach is not going to be emptying into their intestines. They get kind of stupid intestines, and they have a lot more nausea, and you'll see more random acts of vomiting. That just means, oh my gosh, my child was doing fine, but now they puked. And 6 hours later, they puked. So it's random. If you do that, just know you probably advanced their diet a little too fast. So that recovery period that happens after they start to convalesce or get better, you don't want to give them things to slow down their diarrhea, for example, Pepto or Imodium. More importantly is just focus on what can I do to not feed that diarrhea. And antibiotics are rarely indicated if they have diarrhea. You actually can get into some trouble if you get antibiotic exposure. Now, there are some exceptions, and we will have further videos on that, but we'll address some of those things. If you see blood in the poo and they've had exposure to cows, or they've had exposure to like baby animal days, please let your pediatrician or family doctor know that. It's not uncommon for little toddlers that, they start to crawl and pull the stand to get into the dog poo and eat it. Like if you have a puppy or a dog in your house and they have a place where they eliminate. I have had patients get into that and they get Campylobacter, and that's a horrible, nasty, bloody diarrhea illness. If your child has yellow in their eyes, you should tell your pediatrician immediately or get help, seek help immediately. Good luck. Most of the time this is more of a spring, summer, fall problem, but nowadays you never know, it can be all year long. So good luck, and remember, life is a vinegar of feces, so wash your hands before you put them in your mouth. Thanks.